WHBC. This is Canton's Morning News with Tam Cook.
Doctor, I'm screaming, doctor.
Time for us to chat with our favorite family physician, Dr. Stan Anderson. He is on our WHBC Newsline right now. Good morning, Dr. Stan.
Hey, Pam, great to talk to you.
So I was talking a little bit earlier this morning about the Nancy Guthrie case, of course, pretty much gripping the nation right now, but and we're all following the details, but, there is that thought of, if she's out there, boy, she's got some health issues. They say she doesn't have her medication, and this might be a good time for you to kind of fill us in on what all that means.
Yeah, so first off, the thing that everybody is mentioning is that she has a pacemaker. So when somebody has a pacemaker, that means that her heart clearly was not functioning well enough. And it also means that she was probably on a blood thinner in order to prevent blood clots. So blood clots occur whenever there's an increased amount of stress. And quite frankly, if you get abducted, that's very stressful.
Yeah.
So her risk for having a blood clot is dramatically increased. So that's the first thing. The second thing is she apparently has dramatic decreased mobility. So in other words, if they were going to force her to walk long distances, according to their nomogram, she could only walk about 50 yards. So her mobility was dramatically also affected. The third thing is she was extremely in a lot of pain. So she had chronic pain. She had difficulty with her joints. And so the pain medicines were something also that she needed to be on. So here's a woman who is under dramatic stress, who her adrenaline levels are through the roof, and she has chronic pain and none of the medicines. So one of the things that does is that dramatically affects the entire system. She is dramatically more likely to shut down. So one thought that I had was the people that did this, apparently they knew enough to disconnect her pacemaker from her phone.
Yeah.
So to do that means they knew that she had a pacemaker. They had to know something about her health. And then the other thing is they had to know enough about the medicine she was taking and the changes that she was going to be doing in order for them to do whatever they did. So I suspect that it's somebody that knew them or somebody that knew enough about them. This was not a random type of an abduction. This was something where it was obviously planned for them to be able to do it the way in which they did it, the way in which they ended up avoiding all of the cameras. That's clearly somebody that has thought this through. In order for her to get out, there were probably two people involved. So my suspicion is that there was more than one person. And then as to how far they are going to take her, that's where it gets a little bit tricky. Interesting to see whether or not she's still in that community or whether or not they've found a vehicle far enough away to be able to take her far away. That's the real dilemma, the real concern. But here she is. She's in chronic pain. If you're her abductor, you're going to make sure that she never sees you. So you're always going to stay wearing a mask of some kind. And then the other thing is, how do they know what medicine she's on? They don't. Yeah. So they're going to end up basically just giving her some kind of a pain medicine. And if they give her Tylenol or Advil, that can actually make the blood clotting more dangerous for her. So for her, she's in this difficult situation where the usual things that people would do for people that are in pain aren't going to be the best for her. So it's just thought through clearly, executed in a way that they knew what they were doing. They knew where the monitors were. So in my mind, it's probably somebody that has had previous contact with her. And her health is something that really worries me.
Yeah. When they, just to be clear, when they disconnect her pacemaker from her phone, that doesn't change the functionality of the pacemaker, does it? Or
Correct.
does it?
The pacemaker is still working. The
Okay.
pacemaker is still doing. The question is, how long is the battery? Generally, if it wasn't at the end of the line, and that would be my second guess, if the perpetrator knows enough about the pacemaker, they knew that it wasn't going to end up having the battery die within the next few days. So I don't think that's the issue. Really, it's the issue of dramatic increase for blood clots. She's in chronic pain. She can't move. Her blood pressure is sky high. Apparently, she was on 4 different blood pressure medicines. So now that she's off of all that, she's in a very dangerous situation. She's probably going still through a pretty significant shock reaction. It's not a good thing for a parent in their 80s to have to deal with when they're in this. Basically, this is torture in my estimation.
Yeah. And they found blood on the doorstep, hers. So we know that something occurred, during the capture or whatever. So, boy, it's a tough one. It is just such a tough one to continue to watch. But I appreciate all that information, Dr. Stan. A lot of really good insight, helps us understand the things a little bit better. And, well, we'll see. When we chat next week at this time, we'll see where this all stands.
Hey, it's great to talk to you. You take care.
I'm screaming doctor, doctor.